Welcome to the educational videos of the Joint School from Glan Clwyd and Abergele Hospital. I'm Mr. Madhusudan, consultant orthopedic surgeon, and
I'm Dr. Shenoy. I'm one of the anesthetic consultants.
today we are introducing you to some of the educational videos of Joint School from our hospital. You will see a series of videos which are based on the medical input, the input from the surgical team, from the other team supports, including physiotherapy and occupational therapy. And thanks for watching this. And I hope all your doubts will be clarified by the end of these videos. Let us look at the surgical aspect of hip and knee replacements from the Joint School perspective. And in the next set of slides, you will see what is expected of you and what exactly is going to happen on the day of surgery. The learning objectives of this presentation are, I will just run through the process of arthritis. How do I prepare for surgery from your point of view? What can I expect when I'm in the hospital and when I go home? And the physiotherapy component, a bit of it, and we will introduce you to the other team members as well towards the end of the presentation. The normal hip joint is a ball and socket which has loads of tissues around it, including nerves, blood vessels, soft tissues, ligaments, muscles, and tendons. The lining surfaces of the joint are covered with articular cartilage, which disintegrates and the arthritis process begins. This results in a bone-on-bone appearance towards the end of the pathology that results in pain, deformity, and disability. A similar process happens around the knee because the basic process doesn't change much, except that the knee is a different mechanism altogether and is a hinge as compared to a ball and socket on the hip side. What exactly does a surgeon do in a joint replacement? The damaged joint is surgically explored through various approaches. The damaged parts of the joint are removed systematically in a planned manner. An artificial joint is inserted, which is made of metal and plastic, and the wound is closed, cleaned, and dressed. This is a slide which will tell you exactly what an arthritic hip looks like and what are the various components that we are using. And once the procedure is completed, that is how a hip joint would look. As opposed to a hip, in a knee, the metal bits are clipped onto the ends of the bone and glued with the help of a substance called bone cement, and a plastic is inserted between the two metal bits, which will function as the joint. Most of the surgeons would have discussed with you what implants are available and what are the choices which one needs to look into when you have seen them in the clinic. Generally, if the patient is young and if the bone quality is good, we rely on the biology and avoid a substance called bone cement. If the bones are soft, then we use bone cement to achieve stability and fixation. When it comes to the bearing surfaces, we look at a combination of metal, plastic, and ceramic and try to combine them in a feasible manner to get the best outcomes. How do I prepare for the operation? Few things you need to be clear about. You have to stay clear of any infections in the body. If you have any dental issues, it would be worthwhile visiting the dentist and getting a clearance. Keep your skin clear of any cuts and bruises. Follow the advice given by the anesthetist and the anesthetic team in regards to stopping any medications before the operation. And most importantly, you need to choose your team after discharge. You need to identify a friend or a partner who will look after you when you go home and somebody who can bring you into the hospital on the day of surgery. This is a very important step that needs consideration. It was always a good idea to learn and practice post-operative exercises because this will help you in your rehabilitation and the outcomes of hip and knee replacements. If you are overweight, it would be a good idea to optimize your body weight. Optionals, if you have access to exercise, bike, cycling, and swimming, these are other options which you could consider potentially. Most of my colleagues would have advised you about the importance of stopping smoking preoperatively. If you stop the smoking, then it improves your lung function, it improves the circulation, it improves wound healing, bone healing, and reduces the infection rate. When you come into the hospital on the day of surgery, you will meet the surgeon and his team. You will get your operative leg marked. We will check for any cuts and bruises on the legs. You will get to meet the anesthetist and his team, and you should be able to discuss any issues with the anesthetist and allay any fears and anxiety. Once the operation is completed, we give you a sterile dressing, and if it's a knee replacement, we go additionally and put a compression bandage, which will be reduced in about 24 hours. Clips and stitches will be removed by about 2 weeks. Most of the patients are discharged by 3 days, and the discharge date is dependent on how good you are with your mobility pain control. Most of the patients are discharged to home, and some of them may need additional support if they have social issues and if they have other medical issues as well. After discharge, we normally see the patients at 4 to 6 weeks in the clinic, and at 1 year after surgery, you will be asked to complete a questionnaire which will capture the data on the outcome surveys. You will have x-rays to look at the implants and how they are positioned and serially be monitored. After you go home, there will be physiotherapy clinics which will be organized by the nursing team before discharge. When can I go back to driving? It's usually at around 6 weeks when you're cleared by your surgeon. Sporting activities should normally happen between 6 to 8 weeks, but you need to discuss these things specifically with your surgeon. Your hobbies, as able, you should be able to return, but it depends on what you're looking at. Again, it's best to discuss with the surgical team. Thanks.
So today we'll discuss what do you expect on the day of admission. So anesthetic will visit you on the day of surgery. He'll discuss with you your anesthetic choices, and also he'll discuss about pain relief during and after the surgery. So main things, the limitations are you're here because of your pain and mobility issues. The aim is to get you back on your feet, and the limitations of this operation being pain and kneeling. Now, day of surgery, you will meet your anesthetist who will ask you questions on your medical health and making sure you're still fit for your surgery. He'll also discuss all the medications that you are on, and also will tell you or advise you on what medications you can carry on taking. So it's best for you to get all the medicines in their original packaging. You may have already received some information about some of the drugs which you may have to stop before your surgery in your pre-assessment clinic, especially drugs like anticoagulation and non-steroidal drugs. He'll also discuss the choice of anesthetic that you can have. Now, basically, there are two choices. You have a general anesthetic, or you can have something called a spinal anesthetic. I'll discuss a little bit more about this. Now, general anesthetic is a situation where you are in a state of controlled unconsciousness during which you feel nothing of the operation. Now, the advantage of this is that you are unconscious during the operation, but there's a lot of things which we have to do as anesthetists during a general anesthetic. So you'll have drugs to keep you asleep. You'll have drugs to make sure that you are pain-free during the operation. We'll have to control your ventilation or breathing during the operation. Towards the end of the operation, we'll have to give you drugs to wake you up. Now, all these drugs can make you feel a bit sick and tired when you wake up. Even though sickness can be treated with drugs, you can also have a little bit of a sore throat, because of the tube that we put in through your throat to help you breathe. Now, both of these can delay recovery. Now, the other option is the spinal anesthetic. It is the preferred choice for this procedure. What it involves is an injection in the back, which makes you go numb below your waistline, so you don't feel anything during the operation. Now, you can either stay awake during the operation, or if you prefer to have some sedation, you can have sedation and you can sleep during the operation. Now, the spinal anesthetic works for about 3 hours, and after that, the sensation comes back to normal. Now, for the spinal anesthetic, it can be done either by you sitting up with an arched back position or in lying down position. So the anesthetist will tell you that on the day of the surgery. Now, what is so good about this is that you remain in full control of your breathing, and you breathe better in the first few hours after the operation. From what we have seen, from all the cases we have done so far, people who have had spinal do much better compared to people having a general anesthetic. Even though, there are a few disadvantages. You have a heavy feeling of your legs, and that lasts for about 3 hours, and sometimes a couple of hours after the operation, but it comes back to normal. Some people have difficulty passing urine after having a spinal, but that can be treated. Some people may require a catheter. Now, there is chances of you getting a little bit of a headache, and nerve damage, which is very, very rare. Now, the anesthetist will recommend a particular type of anesthetic based on your medical and your health issues. Now, the choice is ultimately yours. It is a good time when the anesthetist comes to see you is to ask all your questions and also tell the anesthetist about the worries that you have about anesthetic. There is a small chance that there may be a delay in your operation. It can happen, normally happens at an earlier stage because they would have identified something wrong with your health, which could be corrected, or it could happen on the day of the surgery if your health, if there is a reason that your health could be improved, or more tests may be required, or there may be a high risk that you may need more time to think about. But as I said, it really rarely happens. So let's talk about pain relief after surgery. Now, knee and hip operations are painful operations, but we do a lot of things to help you manage that pain. It could be done with non-tablets or non-drug therapy, like just positioning your leg a little better will help you with your pain relief. We could apply ice packs on these wounds to help you soothe the pain, or most of the times it's psychological. If you think you are in pain or you will be in pain, you will be in pain. So it is better to prepare yourself, mentally and physically, saying you will be able to do it. So you could have some drugs like morphine or fentanyl, which will help you with your pain relief. You will have some oral tablets like Oxycontin, which could help you with your pain relief. Also, the surgeon could inject local anesthetics. You'll also have your regular medication, which could be a paracetamol. Sometimes low doses of anticonvulsants and antidepressants can help you with your pain relief. And this will be decided on the day of the operation based on your medical requirements. Now, how we manage pain is something called an analgesic ladder, which means that you will have smaller doses of stronger opioids, and if you need more painkillers, we climb the ladder and we can increase the dosage of the pain requirements. You will have painkillers regularly, which the nurses will give you every 6th hourly. Now, if you are in pain in between these time, you can still ask for more painkillers, and the nurses will give you more extra painkillers. Very rarely that we may have to use a pump with the morphine in it, but it is becoming less often because of its side effects. Now, most often, with these painkillers also comes some side effects. People, the painkillers can make them feel a bit sick, can make you feel a bit drowsy, can make you have some hallucinations. Everybody reacts to drugs differently. So if you feel that you have any of these symptoms, you have to just inform the nurse, and these are treatable. We may have to reduce the dose, or we may have to change your tablets. There's something, your anesthetist may discuss on your day of the surgery, something called a nerve block. What it actually means is just an injection of local anesthetic near to the nerves which go to your leg. This numbs the nerve which supply your knee, so you have some pain relief for some few hours, lasting from 8 hours to about 12 hours. This can actually sometimes make your legs go totally numb, and you may not be able to move it. So sometimes It's only in a rare situation that we may have to use these nerve blocks. There's something called local infiltration, which is replacing all the nerve blocks in the UK. What it just means is that the surgeon actually injects a mixture of local anesthetic into your joint, during your operation. This can give you good pain relief for lasting about 8 hours or sometimes more. So let's see what you actually do. So this is a picture of the anesthetic room. So when you come into the anesthetic room, you will be, there's a meet and greet by the team. You'll be connected to all the normal routine monitoring, which is both for spinal and general anesthetic. You will have a general or a spinal anesthetic, which should have already been discussed before. And the anesthetist will stay with you all throughout. This is just a picture of the theater. You will either be awake or asleep during this. Anesthetist will always be with you. You will always be fully covered at all times to prevent infection. Then you go on to recovery once the operation is done. So the main thing here is you will still be monitored. You will be made sure that you are comfortable, and if you need extra painkillers, you will be given this. You'll have a dressing and wound check, and if the recovery staff are happy with you, then you go back to the ward. Now, post-surgery, you can eat and drink normally. You will be fully monitored for your heart rate, blood pressure, and oxygen levels. You'll also have foot pumps to prevent you getting DVT or thrombosis. Deep breathing, foot and ankle exercises are encouraged, and you may be asked to start bending your knees if you're having your knee operation. Now, the key things for success is early eating and drinking, early exercise and mobilizing, and remember to keep on top of your pain by taking regular analgesics, okay? So this will help and aid you in getting home earlier. So remember, you are in charge. You are in the best of health before surgery, and you're not ill. So you need to take charge. Thank you.
Welcome to the nursing element of Joint School for Abergele, Ward 6. What can you expect from today? You will gain knowledge about rapid recovery, a step-by-step information about your stay on Ward 6 in Abergele. You are in charge of your operation. Make sure you are in the best of health before surgery, you are not ill, and you take charge of your recovery and rehabilitation. Prior to coming into Ward 6, ensure any plans are in place for your discharge and arrange any help needed at home prior to having your operation. Please have enough day clothes for 3 days, as you will be having physiotherapy and assessments for walking, washing and dressing. On the day of arrival to Ward 6 in Abergele Hospital, please bring all your medication, suitable clothing, footwear and toiletries. Please shower or bathe at home the night before admission. Please do not shave the surgical area. You will be asked to put on a theatre gown. Your temperature, blood pressure and breathing rate will be checked. Going to theatre from the ward. The nurse will prepare you for surgery. Dentures, wigs, glasses, hearing aids, etc. can be worn to theatre. These can be removed in the anaesthetic room and given back to you in recovery. Theatre staff will ensure dignity is maintained at all times. Post-operative care when you return to the ward. Your heart rate, blood pressure and oxygen levels will be monitored. Foot pumps will be provided to prevent thrombosis, which is a blood clot. Deep breathing, foot and ankle exercises are encouraged post-operatively. You will be expected to walk on the day of surgery or day 1 post-operatively. Toileting post your surgery, passing urine. Early mobilisation to the bathroom post-surgery is essential for your rehabilitation. If you are unable, the nurse will assess the best options for you to access the bathroom. Please tell a member of staff if you feel nauseous or are in pain. You'll be able to start eating and drinking once you're back on the ward. Pain management post-operatively. This will be managed on the ward. Pain relief will be given with the appropriate pain score. This will be assessed and prescribed regularly and for breakthrough pain. During your stay in hospital, 1 to 3 days, physiotherapy will consist of chest maintenance, hip exercises, regaining your mobility. You will be seen regularly by a member of our team, but it is up to you to practice your exercises on your own. On the ward, any drips will be removed, you will be out of bed and dressed in your own clothes. You'll be seen by a physiotherapist, regular observations will be carried out, and you need to inform a member of staff if you are feeling nauseous or are in pain. A blood test and an X-ray will be performed, and then we'll plan for discharge. On the day of your discharge, you will be discharged from hospital when the team are happy with your progress. This will be on day 1, 2 or 3 post-surgery. The nursing staff will ensure you have the correct tablets to take home and any instructions will be given to you. You will be referred to a practice nurse or district nurse for follow-up care if required. Outpatient appointment will be arranged with the consultant. If you have any questions, problems or queries when you get home, please contact your consultant's secretary and they will advise you on the best course of your query. Please do not go to any other healthcare professional about your wound or operation. This should be managed by your consultant. Thank you.
Hello, my name's Catherine Jones. I'm the occupational therapist for orthopaedics in Abergele and Glan Clwyd Hospital. This is just a short presentation about how occupational therapy can support with recovery from your total knee replacement. The aims of this presentation is to outline the role of the occupational therapist, provide advice on managing activities after the operation, and provide contact details for the OT team. So our role is to help you be as independent as possible with day-to-day activities. This can include washing and dressing, getting on and off furniture, and managing your meal preparation. We will assess for temporary equipment if needed to promote independence and safety around the home. We will also support you to manage your day-to-day activities by adopting new techniques that could minimise your pain. We can advise you how to prepare your home and what arrangements you would need to make before you come in for surgery. These are some of the activities we will be supporting you to manage after your operation. So bathing, we would recommend you do not have a bath or step over the side of a bath to access the shower following your surgery. Instead, you will need to have a strip wash during this time. We recommend you are seated while having your wash. If you have a shower cubicle or a walk-in shower, you can continue with showering post-surgery if you have a watertight dressing. If you have concerns about the step into the cubicle or steadiness when standing to the shower, then you can discuss options to manage this with the occupational therapist. Kitchen activities, it would be best to have a table and chair in the kitchen or a high stool that you can eat at the worktop. You will likely be walking with walking aids on discharge, so you will not be able to carry plates of food or hot drinks through to another room. Post-surgery, you might initially find that your tolerance to stand for long periods of time to complete full meals will have reduced. We would advise you ensure that you have somewhere to sit at the kitchen so you can rest and take pressure off your leg when waiting for meals to cook or the kettle to boil. Try and arrange your kitchen so that you do not have to excessively bend to get things out of the cupboard or the fridge. It might be best to put things you use day to day on your worktop to avoid twisting, overreaching or bending. Please consider making meal preparation a bit easier initially on discharge. Look at meals you would be able to heat up in the microwave or quickly make on the hob. You could prepare some freezer meals in preparation. So chair, bed and toilet transfers. We advise you to push up from the furniture rather than pulling up on your walking aid. An armchair enables you to push up into standing from the arms of the chair. Consider using an armchair rather than a sofa if possible. Drive up to standing using the leg that has not just been operated on. Where possible, get onto the bed leading with the leg that has not just been operated on also. Steps and stairs. Physiotherapy staff will teach you how to safely complete the stairs if you need to be able to manage these on discharge. Where required, additional rails to assist with step and stairs. This can be arranged. Please contact the OT team to highlight any concerns. Household chores. You should try and keep up to date with the household chores before coming into the surgery. Ensure support has been arranged with shopping or cleaning if you need that. You should avoid heavy chores such as hoovering and changing beds. You will need help with these for the first 3 months. Spread household chores over a period of time so you don't become overtired. Light chores such as washing dishes and ironing are okay. If possible, sit down on appropriate furniture when ironing or washing the dishes. Please prepare the house before you come in for surgery. This might include removing any rugs or mats, such as bath mats, hearth rugs or hall runners. The crutches or sticks that you'll be using after surgery could get caught as you walk on these, so roll them up and remove them for the time being. Please make sure there are no trailing cables, such as plug extensions, phone cables. Roll them up, as whilst you're using a walking aid, these can also be a trip hazard. Ensure there is sufficient room to move around with your walking aid. Always put a light on if moving around in the night to go to the toilet. You are perhaps using a walking aid that you're not used to, so you should make sure the areas are well lit whilst walking at night. Shopping and driving. We would advise that you check with your consultant when you might be able to resume driving. This is normally 12 weeks following your surgery. Ensure you're able to perform an emergency stop effectively. Check with your insurance company you are covered on return to driving. With food shopping, we advise you arrange for family or friends to support with shopping tasks, as you will not be able to carry bags of shopping into your property. Prepare long-lasting or freezer food, and we also advise that you get to grips with online shopping. This might make things a bit easier for you on discharge. Getting in and out of a car. You will be able to travel in a car as a passenger. Ask the driver to park on level ground and move the seat back as much as possible to give the maximum amount of legroom. Position yourself with your back to the car. Make sure you can feel the car at the back of your legs. Lower yourself gently into the seat. Slightly recline the seat if possible. Bring legs into the car by leaning back, keeping thighs in contact with the seat. To get out of the car, reverse this process. Things to remember when you do come into hospital. Please bring in loose-fitting clothing that you're able to get dressed into yourself using the long-handled aids if you need these. A wash bag with your own toiletries to keep your own routine from home. Slippers or shoes without laces with a supportive sole and back on them. Books, knitting, magazines, puzzles or anything that you might use to keep yourself occupied during the day. Please remember you are in control. You are in the best health for your surgery. You are not ill and the pain you are experiencing should only get better from this point forwards. You are in control of your recovery. Moving will promote a better and quicker recovery. You are likely to experience some degree of pain. Please remember to take the pain medication as advised by the medical team to enable yourself to keep moving and progressing with your recovery. Inform nursing staff if you feel your pain medication is not effective. So we do ask you to prepare and adapt the home as much as you can before you come into hospital. When you're in hospital, please get up to the bathroom and get washed and dressed as soon as you can. Please take the pain medication as required and complete the physiotherapy exercises as advised. Things we ask you to avoid when you come in for surgery. We do advise you not to stay in the bed or the chair. We also advise you not to wait for physio to encourage exercises. Also wait for the OT to prepare their home environment before you come into surgery. Please don't try and fight through the pain without the medication. As mentioned earlier, please ask for the medication if it's not effective. Please remember to arrange any support you might need for when you come home from hospital. For example, with food shopping, meal preparation or laundry. Please prepare your house ready for when you come home from hospital. If you're struggling to carry things around the home, please consider using a flask for hot drinks or Tupperware with food and use a backpack to carry these. So the OT team do not routinely assess all total knee replacement patients. If you feel like you would benefit from an assessment, please contact the OT team before your surgery to arrange this. Please do not hesitate to contact us with any queries. You can do this by calling the main office and ask for a member of the orthopaedic OT team. Our contact number is 01745 448 788 and extension 6171. Thank you very much.
So, hi, my name is Beth. I'm one of the physios from Anesthetic Glan Clwyd, and this is a total knee replacement presentation. So, the role of physiotherapy following a total knee replacement. So, our job is to provide education about your surgery, provide individualised exercise programmes, assess your mobility and provide specific walking aids such as elbow crutches, Zimmer frames, walking frames, and we need to restore your function and mobility and promote early return to independence. So we want you to get home as soon as you can, as independently as you can. So on the day of surgery, we'll be asking you to commence your exercise programme. This is to promote circulation, strengthening and range of movement. And we'll be asking you to get out of bed and sit in your chair with the nursing staff if you're medically able to do so. We generally ask you to start walking with the appropriate walking aids at this point as well, just to try and get into the habit of it. So during your hospital admission, our job is to try and assess and progress your mobility with the appropriate walking aid. We'll be asking you to commence ice therapy, so putting an ice pack on your knee, and it's usually for about 20 minutes. That's to try and help with the swelling and the discomfort. We'll continue with your exercise programme, working on those bases of circulation, range of movement and strength. We'll be practicing the stairs or the steps as needed, and we'll be discharging you with a referral to your local outpatient physiotherapy department to carry on with the strengthening, the exercises and the range of movement. Okay, so milestones in your recovery. So we want you to be independent with your walking aid, independent with your bed and chair transfers, independent when doing your exercise programme, safe with your stairs or your steps, and we want you to have range of movement in your knee up to 90 degrees. So our top tips, so we just want you to remind you that visiting time might be interrupted by physiotherapy turning up. Unfortunately, we can't schedule when we'll get to patients, so sometimes this could be in the afternoons. Be motivated to exercise and to walk regularly throughout the day as advised by your physio. So this is when we're not with you, you're carrying on doing your exercises and you're getting up and having a walk with the ward staff. Remember to take regular pain relief. Remember to do regular ice therapy to help reduce swelling, and this is for around 20 minutes. Putting it on, leaving it on, and then taking it off. And begin your knee exercises before your operation, obviously within your pain tolerance. We don't need to be putting yourself through agony, but we do want you to be trying to do as much as you can. Thank you very much.
Thank you for watching these short videos. I hope you find it very useful. Rest assured, we are all here to help you through your journey of the surgery. Thank you and best wishes.